Hi everybody, welcome back again to a few minutes with me today. As you know, we do a couple of minutes in pediatric neurology, but this time I thought I would do something a little bit different as opposed to the usual couple of minutes. And the reason for that is that I recently had a meeting with the medical students and interns where I do the teaching, and they asked me a very interesting question that Dr. Aman, we are going to become health professionals soon after we finish our internship. What kind of doctors should we become? And that made me thinking that when I was an intern or when I was a junior doctor, what kind of a consultant I wanted to become. And I had been thinking about this throughout my training period as a junior doctor, that when I become a consultant, how do I become? I had really good mentors who taught me, not just medicine, but how to deal with patients. And this is for those medical students and interns who actually asked me this question, and other medical students around the region, around the world. I always think that there are two types of health professionals, or in my case, consultants, because that's where I am and that's how I look at my colleagues. There's one type of a consultant who I call A, not for any reason, I've just chose a random alphabet to just call them A. And these are those consultants who are really knowledgeable, cutting edge, high tech, and they've gone through all the books and they have really good experience. But what they're lacking is how to communicate with the patients. In my case, for example, pediatrics, how to communicate with a child, how to communicate with the families, how to express to the families and children that what they're going through. Do they have enough empathy? I don't use the word sympathy, I use the word empathy. Do they have the empathy to describe to the families and children that what is going on with them? So, type A consultants, cutting edge in terms of knowledge, which is very good, but what is lacking is communication skills. That's lacking. So, really good in knowledge, but not so great when it comes to communication skills, how to explain to the families. The second type of consultants, I call them type C consultants. Again, there's no reason why I chose C, you can choose D, E, F, whatever you want. These type of consultants are decent, reasonably good consultants when it comes to communication skills and talking. They are really good at that. They explain to the parents and the families what's going on, but when it comes to knowledge, it's not there where it should be, for whatever reason. For example, somebody has not gone to CMEs, not gone to conferences to upgrade their knowledge, and they're still quite way behind where they should be in terms of knowledge. But they're good at communication skills. But when it comes to knowledge, a little bit lacking. I think, what do I need to think is which group I need to be in. Am I in this group or am I in this group? And which group should I be in? As I progress in my career as a junior doctor, I realize that I don't want to be here in this particular group. Why? Even though I'm really good when it comes to knowledge, but if I can't impart that knowledge, or if I can't speak to the families in a way they understand, I can't speak to a 6-year-old the way he or she understands, I'm no good here. There's no point me being here. Here, definitely no point being here, because if I don't have the knowledge how to deal with a condition or a child's problem, then talking is not going to help me either. So what do I need to be in? Where do I need to be? I'm just going to erase this, all of it, and I'm going to make another chart. I need to be somewhere here, and I call them the B doctors. Why B? Again, no particular reason why B. The reason for B, I call them is you want to be that doctor who knows the stuff and has got good communication skills. It's a bit of both, hence the reason B. This is the doctor which I want to be, who has the knowledge and the empathy both when they speak to the children and their families. And this is where every pediatrician or a doctor who wants to be a health professional should be in between, so that the families have trust in them. And this is not just in medicine. I think this should work in all walks of life. You can be very good at what you're doing, But if you're not able to express yourself in a way a person understands, or a simple way that other person understands, I don't think it will matter how good you are. So you want to be someone who knows the stuff as well and is able to translate this as well to the person you're speaking to. There's a very old saying which I always say. We're getting a bit philosophical here, but that's how it is. Do you want to be the person when you walk into the door, people are happy? Or you want to be that person when you walk out of the door and people are happy? You want to be that person here that when you walk into the door, people are happy, not the other way around. I will end here, and again, just to emphasize to the junior doctors that be a professional who knows their stuff and has communication skills as well. Thank you very much for listening today. My name is Dr. Aman Sohal, and I'm a consultant pediatric neurologist.